Good afternoon, everybody. Thank you very much for joining us today as we are taking the next steps in MIPS for this year. MIPS 2022, maximizing your success. I know it's not the last 90 days, but this is the stuff that you should be doing in your last 90 days. Today, I am joined by Mara Flaherty. She is another MIPS specialist. Hi, Mara.
Hi, Mike. Thanks for having me.
Of course, and we're going to walk you through this presentation as well as be available for some questions at the end. As you can see in your GoToWebinar widget here, there's a section for questions. Please feel free to ask them. If we have time, we'll get to them. Otherwise, Mara, I will sure be able to get you those answers following the webinar. As well as you'll see on the bottom right, there are some handouts. I think I have 3 in there, a little bit about the MIPSPRO product, as well as today's slides from this webinar, and a little bit more information about our product here, MIPSPRO. Also, to let you know, if you can't stay the whole time, I will be sending this video on after this meeting, as well as all of the slides. So you'll have both the slides and the video to go over after this. So today we're going to review a couple of things. First, 2022 MIPS reporting, what you need to know, what you don't, where you need to attack at this point of the year, as well as tips on how to maximize that return, and then how MIPSPRO can work for you and how we can get you to where you need to go. First off, I want to start with the MIPS reporting frameworks. This is similar to last year. There has been a little bit of updates. If you've been on some of these webinars, you've seen this slide before. And just to let you know that this presentation is not taking a real deep dive into MIPS categories and into the nooks and crannies of the MIPS program. It is a general overview of what you need to do in your 90 days. So if you are a MIPS expert, 1, we're hiring, and 2, just so you know, you might not find this meeting as helpful as some of the other presentations that I've done. So when we're talking about MIPS reporting frameworks, today we're spending our time in the traditional MIPS area, where you have group, individual, APM entity, as well as virtual groups. And then there is the APP performance pathway. So that is mostly what the ACOs are moving forward and how they're reporting. And then we have coming in 2023, it's proposed, but we're pretty confident that it's finally here, is going to be the MIPS value pathways. We'll hit a little bit of that at the end of this conversation, but for the most part, the MIPS value pathways are an interesting way to get providers to report quality data and be scored on cost data that is more related to the everyday dealings they are having within their practices and hospitals. So I am going to turn it over to Mara as she's going to go through some of the ins and outs of MIPS reporting in 2022. Go ahead, Mara.
Thanks, Mike. So just diving right into kind of a broad overview of what traditional MIPS is looking like in 2022. So we have the breakdown of each of the 4 MIPS reporting categories. In 2022, cost and quality are worth 30% each, so equal parts cost and quality. And then the promoting interoperability category is worth 25, and improvement activities are worth 15 for 2022. In terms of eligibility, looks the same as it has in the past. So that is if a group or provider is billing $90,000 or more dollars in Medicare Part B, and 200 Medicare Part B patients, and 200 covered professional services, they will be required to report MIPS in 2022. In terms of performance thresholds, 75 is that penalty avoidance threshold. So in order to not receive a negative payment adjustment from CMS in the 2024 payment year, providers will need to achieve 75 points or higher. And then that exceptional performance threshold is going to be 89 to 100 points. So that's where you're going to be seeing the increased reimbursements from Medicare. And then same with the 70% is the quality data completeness threshold. So you need to be reporting on 70% of all of your patients throughout the 2022 year. Next slide. Okay, so right here we have reporting exemptions and eligibility based on the separate MIPS categories for 2022. So on the left here is kind of demonstrating if a provider is cost exempt based on their specialty, their cost category score will be reweighted into quality, making that worth 60% of the total MIPS score and leaving PI and IA at 25 and 15% respectively. In the middle, given that a provider is PI exempt or takes an exemption for 2022, that those 25% will be split up between quality and IA, making quality 40%, IA 30%, and then cost remains at 30% of the total MIPS score. And then lastly, if a provider were to be both cost and PI exempt, that will leave you with 50% quality and 50% IA. And these numbers are all based on small practices. So 15 providers or fewer, this is what your weighting will look like given these specific exemptions. So for larger practices, this will look a little different, but we can help you navigate that as well.
Right. Hey, thank you. I just want to add on to this too, with this being for the small practices, the large practices, that last category is 85 quality and 15 IA. So similar to last year. So the last two circles you see here are new for 2022. Very important and a little bit easier for you to actually be able to perform well in these programs, which Mara is going to go over on the next slide.
Thanks, Mike. Okay, so yeah, kind of piggybacking off of that last slide, giving these specific exemptions, we've kind of drawn out the path to 75 points in order to avoid that penalty. So given that a provider is not exempted from any of the categories, they're reporting on all four, you'll be looking at 25 minimum quality points, 20 in PI, 15 IA, and 15 in cost to avoid the penalty. So that's, again, given that you're reporting on every category, and we say that you're scoring about half in the cost category, and then that's kind of the baseline across the board here. So then moving over to the next scenario, wherein someone would be exempt from cost, so reweighting that into quality and PI, excuse me, just quality, we assume that you would need 40 points to 40 points in quality, 20 in PI, and 15 in IA to reach that 75 mark. Moving over into the next column here, if PI is reweighted, we assume that you will need 30 points in quality, 30 in IA, 15 in cost to reach 75 again. And then finally, if cost and PI are both reweighted, you'll need 25 points in quality and the full 50 in IA to reach the 75 point threshold. So again, all of this is to say that it is becoming more difficult to score well in quality, but with reweightings, it's going to be important to keep your quality score up to account for the other categories that are being reweighted. Next slide, please. Okay, so you might be asking, how do I know if I will be impacted by the cost score or not? So CMS's goal is that all clinicians, year after year, more clinicians are being added to the cost scores. So we've listed out here specialties that are impacted by costs and that have measures associated with them for the cost score. So if you see your specialty here, you will be assessed a cost score in 2022. And we can help you with our MIPS cost analytics tool, get more insight into exactly where those measures are coming from and what your data looks like for 22. Next slide, please. Okay, so starting to get into the quality specific category here, on bonus points, CMS has removed bonus points from high priority measures, outcome measures, and end-to-end reporting bonuses. So if those are things that your practice has relied on in the past, we just want to make you aware for 2022, they will no longer be available. The rationale behind that is that they were temporary to begin with, and removing them makes scoring of the overall category more simple. Additionally, most of the measures that we see people reporting on past several years are high priority or outcome, so CMS is not seeing them as a bonus any longer. Next slide. Then I'm going to turn it over to discuss the quality measures here.
Sure, thank you, Mar. Catch on my computer, slide changing is going slow. All right, so MIPS 2022 quality measures, there were a number of changes. Everybody should hopefully be aware of them right now, but just to review, when it comes to the MIPS CQMs and ECQMs, what you can report here with HealthMonix, there have been only a couple of new measures added, as well as they did get rid of 13 CQMs in 2022. That is a big drop in the number of CQMs that are available and some popular ones. And just, you'll see it in a little bit later in the presentation, but there's even more expectations of a drop in those measures for 2023. There was also measures finalized with a substantive change. There are 70 of those in the CQM arena. Just to give you a good heads up, those changes sometimes are very minimal, but they call them substantive because they do impact what patients are eligible for those measures. So for instance, it could be new codes, it could be adding social workers as a denominator eligible visit, or it could be a number of factors within the numerator, like certain medication now being included, a certain type of patient, like if they have a disease state that might be included or excluded. Those are the changes that are in these measures. So overall, there were 87 changes in the measures. Keeping with that, just to go over the measures a little bit further, there are the measures in 2022 are being categorized with class 1, 2, 3, and the new one is class 4. So for class 1, those are your normal measures that you're very used to. There's no change in that. Measures can be scored based on performance. That means they have a benchmark. It meets the case minimum, which is 20 instances for the measure, as well as meets the data completeness, which is 70% for 2022. So the current scoring policy for that is you get 3 to 10 points based upon your performance compared to the benchmark. Then there's the class 2 measures. These measures are submitted with data completeness, but don't have one of the two following, which are meet the case minimum. So let's say you only had 5 denominator eligible visits in there, or there's no benchmark. Those you will get 3 points for in 2022. Now for class 3, measures that are submitted but do not meet data completeness threshold, even if they have a measure benchmark and or meet the case minimum, MIPS eligible clinicians that are in groups smaller than 16, so 15 and below, they will get 3 points. Those that are in larger organizations will get 0 points for this. And then finally, the last one is for measure class 4, and those measures are for new measures. So new measures, in most cases, may lack a benchmark, may not meet the case minimum, and so forth. And the minimum amount of points in the first year that you can be given would be 7 points. So you could get 7 or 10. And then on the second part, if it's in the second year, so in 2023 for those new measures, the minimum score you could get is 5. So for measures that cannot be reliably scored against the benchmark because they lack a benchmark or do not meet case minimum, it's going to be 7 points in the first year and 5 in the second year. Good idea to come up with some new measures that you can implement within your practice, because 7 points on a measure is a significant gain. If you take a look at these quality measures of what's topped out and so forth. This is what I just went over, but this is the no change for a 3-point floor for program year 2023. If a provider meets the requirements, 20 eligible instances, 70% completion percentage, they cannot score lower than 3 decile points for measure. And then the addition of the scoring policies for 4. So I'm going to throw it back over to Mara to discuss improvement activities.
All right, thanks, Mike. So for improvement activities, the requirements are 50% or more of all providers in a group must perform the same activity for any continuous 90-day period. So we are within the last 90 days here, so they will have already need to have been started throughout the year. We really consider IA kind of a given, as I had shown in the chart where we mapped out the ways to 75. There's no reason that a practice shouldn't be reporting on IA. All you need to do is document that you are participating. We are required to complete random audits, so you need to just prove that you've done these activities, and you will get full points for the attestation of improvement activities. For large groups, you can complete 2 high-weighted activities, 1 high-weighted and 2 medium-weighted, or 4 medium-weighted activities. And then for small groups of 15 or fewer clinicians, you can cut these numbers in half. So, excuse me, large groups need 40 points total in the IA category, and small groups only need 20. So that will result in either fewer activities or the lower weighted activities will get you to that 20 points. Next slide. Okay, so for the improvement activities, these are some of the measures that we've seen reported on frequently throughout the past couple years. And we find that it's often things that are already happening within the practices. So really no need to change workflows. It's just a matter of documenting them and then uploading that into your registry and getting credit for the category. Next slide. Okay, so diving into the promoting interoperability performance category for 2022. First thing you need to do is confirm that you're able as a practice or as a clinician to report PI, and that will require you reviewing your EHR and your EHR version that you're on to confirm that it's 2015 CEHRT. Which is what enables you to report on the PI category. And you can do that at the Chapel Health IT site that's linked here. And just input your EHR and what version you're on, and it will let you know if it's 2015 CEHRT and if you can report on PI. Next slide. Okay, so again, what do you need to know in order to report? For 2022, small practices, so 15 or fewer clinicians, will be automatically exempt. So if you fall in that category, you do not need to report PI. You can, and a reason you might do that is if you aren't confident in your quality score, diffusing some of those points into the PI to give you an opportunity to achieve those points is a strategy that we're seeing people use for this year. On top of the automatic exemptions for small practices, clinicians like nurse practitioners, therapists, psychologists, and other non-patient facing providers are all automatically exempt as well. And then if you're not automatically exempt, there are ways that you can apply for one. So if you're on a decertified EHR or due to extreme and uncontrollable circumstances, you can log into your QPP account and apply for an exemption for the whole performance category for 2022. Okay, so here this table just lists out all the possible measures for 2022 in the PI category. So they fall under different objectives and then specific measures. There are two required measures for 2022. That is performing the security risk analysis and the SAFER guides. Both of those are not counted towards your score for PI, so you're not receiving points, but failure to complete them will result in a 0 for the PI category. So very important that they're completed. They can be done at any point throughout the year. And if a provider does meet the criteria to claim exclusion for a specific measure, the points from that measure are just reweighted within the PI category to another objective that is completed. Okay, so what do you need to do in the last 90 days? You need to complete the security risk analysis. Like I mentioned, failure to complete it will result in a 0 for the PI category. And then in terms of your technology, check that you can or already have sent and received electronic referrals or transitions of care. And then additionally, make sure you are reporting for the two registries, take advantage of the bonus points, which were listed on the last slide for reporting on one of the other three optional registries. And then lastly, make sure your patients have access to their health information, whether that be through a patient portal. And then the last thing we have is just pick your best 90 days. Doesn't have to be the first or last 90 days of the year, can be at any point. So you want to pick the days where you are scoring the best and gonna set your practice up for the best best PI score possible. Then I'm gonna turn it back over to Mike to discuss costs.
Cool. Before I discuss costs, I'm gonna throw a little poll out there that we have today. Are you ready to succeed in the last 90 days of MIPS? I probably should have done this earlier, but let's see what everybody's results. If everybody doesn't mind voting on that, that'd be great. The yeses are in the early lead. Heavy voting still coming in with the yeses in the current lead. Great. Thank you very much. Over 70% of the people voted, and 71% of them are saying yes, they're prepared. 29% saying they are not. Either way, I highly recommend reaching out to us, or if you're already a partner of ours, to our customer support and our account management team that we have here. All right. Let's go on to the next screen as we are coming down. This is also a great time if you have questions to get your questions in for us. So the cost category for MIPS this year, as you can see, moved to 30% of your overall score in 2022, up from 20 in the previous year and all the way up from 10 in 2018. An interesting part about the cost component is that in 2021, 2020, and 2019, it was made exempt due to the COVID restrictions. And with that, or the COVID exemptions, sorry, with that, we haven't seen cost scores attached to a MIPS provider since 2018. And back then, it was such a small percentage of your score, at 10% of your overall score, that it had very little impact in 2018. Oh, we just did have a question come in. SAFER guidelines were not added in 2022. I believe that is correct. I will follow up with that, but I believe that that was actually taken out and taken from a wrong slide in our presentation, so I apologize. I want to make sure I got a quick response to that one. Cost scoring overview, the cost category is weighted at 30%, as we've seen earlier today, and it's for individuals, groups, virtual groups, and so forth. The cost category is weighted to 0% for APM entities reporting via traditional MIPS. And then for the cost category to be scored, a clinician or group must meet the minimum cases for at least one cost measure. Each of the measures do have a different cost rating in there. And then if no case minimums are met, the cost category will be reweighted, as you saw on the previous slide that we had on there. The different cost measures that are available right now, 2 population-based cost measures. We have the MSPB, which is the Medicare spending per beneficiary, as well as the total per capita costs, which is the TPCC. Those are the ones that have been around since 2018 and have been associated with your overall score. There are an additional 23 episode-based measures, or 15 procedural, 6 acute episodes, and 2 chronic care episodes. If you want more information on the cost category, you can take a look at our website, MIPSPRO.com, and then or healthmonics.com, and you'll be able to see information on the cost category that goes a little bit more in depth. So when it comes to these measures, a lot of people ask, well, how do we get attributed to them? So there's 2 ways to be attributed. One is based on a provider specialty and or service that's being done, and the other ones are done based upon an episode trigger based service. So you're either are attributed as a primary care provider. In a lot of cases, those aren't just your internal medicines and primary care providers. We do have lists like that on our page of who would be associated with that. That's the TPCC measure. MSPB, that's the Medicare spending per beneficiary. Those are going to be done to providers that are sending people into the hospital, admitting people into the hospital. And then the other ones are mostly going to be done by specialists. Those are the episode measures, and they're triggered based upon some type of service, and it includes a period of time before and after the procedure or service is done that will be included in the total cost of care for that patient. Additional services, as I said, are assigned based upon the timing and the trigger event. They are risk adjusted based on the patient risk factors. So a patient that has, a history of cardiovascular disease or high blood pressure and so forth will be risk adjusted so that it's not as impactful since that patient already has some comorbidities. Measure calculation is based on the average of all episodes. So there is not one measure. If you have 5,000 patients in the total per capita cost and you have 50 patients in one of the episode measures, they are going to be equally weighted in your cost score. So that you would add those together and then divide by 2 to give you what your cost percentage score would be. And then all applicable measure scores average to provide the cost category. So anything that you're eligible for, while there are 25 measures out there, if you're only eligible for 5 measures, they'll be added up and divided into a category. So the performance feedback report. So this is an area that you can go in and see what your scores were in the past. There are payment adjustment of submission data, as well as connected clinicians, different categories that you could go into and get feedback reports on. And then I believe those dates there should be 10/1/2021 and 12/31/2021 for that at the end there. And also on top of that, there is a data feedback from your HARP account that you can get on the cost category and whether costs would be utilized to you in 2021, even since it was not something that was eligible and they took it out and made everybody exempt. I'm gonna toss it. Oh, I think I'll do this slide and I'll toss it back over to Mara. So one of my tips and tricks, if you've been part of my webinars in the past, this is a really important one to understand and really get a grasp of, is that you can report as a group and individual at the same time. Reporting as a group and individual will maximize your score for each individual provider. So individual scoring, if each provider gets their own score, some will be below the 89 and some will be above the 89. It's hard to meet the 20 patient minimum for some of the measures that are low volume measures. And then you cannot take advantage of patients seeing multiple providers and what the score is. Group scoring, everyone gets the same score. It's pulled down by lower scores. So if you have providers that aren't performing well, you're going to be impacted there. And then the issues with providers not carrying their own weight. This happens very often in practices we work with, where there may be a couple of providers that are doing very well and they get upset at the providers that are dragging their scores down. So the best thing that you can do is to report both. Providers that score better than an 89 individually will get their own score. You have a couple people that hit 100, they'll get 100. Those that score less than 89 will be given the group score. Both of those scores are handed out without impacting the overall scores and the group scores. You could take advantage of the 20 patient minimums, specialty providers within your group. If you have a couple of providers that can answer one or two MIPS questions at a perfect score at 20, 30 patients in the denominator, sometimes that's better than doing the smoking cessation counseling for every patient 18 and over, or for answering the flu vaccine twice a year, which tend to be easier measures to do, but the volume of you needing to report that's very high. And then it does take advantage of your top performers. Those top performers can receive extra and incentive than what your group would have. And, every penny counts when, Medicare continues to reduce the amount of they're paying for each one of these procedures and visits and so forth. So I'm going to turn it back over to Mara.
Okay, so shifting gears here from 2022 kind of final rule into 2023.
Sorry.
You good? Okay, so preparing for 2023, as has been in the trend for the past several years, MIPS is getting more difficult. So we are really recommending that our users set up early on in the year, whether it be before the end of the year this year or January 1, to be able to track your data from the beginning of the year. This is going to allow you to really attack your gaps in care and maximize your score throughout the whole of 2023. We also recommend getting your security risk analysis, PI and IA out of the way early so that you're not scrambling within the last 90 days of the year, and you can focus again on tracking and improving your scores throughout the calendar year for 2023. Keep your team accountable from day one. We don't want you waiting until the summer to start thinking about entering your MIPS data. We want you to be in MIPSPRO on January 1st, entering your data and making sure everything looks good so that you are set up for the end of the year. And then also review your 2022 MIPS quality measures and see if your measures are still available, if they're topped out, or if it makes sense to change anything for 2023, and know that ahead of time going into the year so that you have a plan and you're set up for success in the following year. All right, proposed changes for 2023. So MIPS is, there are a few things in the proposed rule haven't been finalized yet by CMS, but these are what it's looking like. No longer an additional performance threshold for exceptional performance. So in 2022, I had mentioned earlier that is in that 89 to 100 range is the exceptional performance for 22. That's no longer around for 2023. In terms of quality measures, there are 9 proposed new quality measures and 14 being removed. A maximum cost improvement score, 1 percentage point out of 100 percentage points are established for the cost performance category. This is what's been proposed by CMS. They will also, again, discontinue reweighting for certain clinician types and then continue reweighting for others. So important to keep an eye on that depending on where your providers fall for the reweighting. MVP reporting will be available in 2023. 5 new proposed MVPs and revisions to 7 of them. Okay, so quality measure overview, which measures are changing, which are being added. So again, focusing on CQMs here, there are going to be 8 proposed new CQMs and 56 with substantive changes. Again, Mike mentioned earlier that looks different for every measure, but definitely important to keep an eye on that. See if those are measures that your practice has been reporting on, and if you might need to change it up for 2023 based on that. But across the bottom, we see that there are 9 proposed added measures, 75 with changes for a total of 194 total. So the point really here is to make sure you know what measures you're reporting on ahead of time, and make sure that they are going to be the best ones, again, for your practice to achieve the maximum quality points. And I'm going to let Mike discuss the slide here.
No problem. So this one is a little hard to follow, but it's really interesting when you take a look at what different scores that you can get as an individual in 2023. So with 2023, with the introduction of the MVPs, you'll have the ability to report MVPs in what's called a subgroup, and with those subgroup scores and where they fit in with your MIPS full group scores as well as individual reporters. As you can see up at the top, the full group score would have been a 90. They have 2 different subgroups, one's an 80, one's a 97. And then you have a couple individual scores there as well. So if you are individual provider A, as you can see on the bottom chart, you have a full group score of 90, a subgroup score of 80, and an individual score of 98. In this case, you will get the 98 score. Jump down to D, where you have a full group score of 90. You were not part of any of the subgroups, and you have an individual score of an 88. Therefore, you'll get a 90, the highest of the 3 scores. And then finally, if we jump down to G, you'll see the full group score once again is a 90. They're part of that FG subgroup that scored a 97, and their final individual score is very poor at a 60. So with those 3 scores that you see there, the final attributed score for that provider will be a 97. With this, it's showing all the different options for scoring in the future that are going to help subgroups and help smaller groups of providers maximize their scores moving forward. And back over to Mara.
Cool, thanks, Mike. So again, diving more into the proposed changes for 2023, I had mentioned 9 additional quality measures being proposed. These are all listed here, so it might be worth revisiting to see, based on measure specifics and everything, if these are going to be relevant for your providers, and additionally, if there are measures being removed that these might be replacing. Next slide. All right, so we really are emphasizing determine your strategy early, make a plan, get started. So wanted to discuss quickly why a registry, how we can help you specifically succeed in 2023. So we are really focused on maximizing your ROI, improving your scores to get you the best reimbursement from CMS come the following payment year. We offer more measures, so we have over 200 quality measures. A lot of them are going to be more specific to your specialty than what you might have through your EMR or through claims data. And we allow you to pick the ones that align most closely with quality actions you're already taking based on your specialties. Additionally, utilize experts, so you can work with our team throughout the year. We help you navigate through changes in the MIPS program, as well as through utilizing our MIPSPRO registry tool. So we're really here with you throughout the whole process for the year, and we want you to succeed as well. Our technology allows you to combine data from multiple EHRs, PMs, and other healthcare technologies, which has been really effective for many of our clients who are either transitioning throughout the year or anything where you have multiple data sets. We can help you combine those. And then again, we just want to help you track data all year long to allow for performance improvement. We also can report on both ECQMs and CQMs, whichever aligns more closely with your specialties in your practice. And then we also help you dig into your data and attack gaps in care. Another reason we want you to be able to have access all year and start reporting from January 1st. Okay, so what to do today, really still emphasizing, make your plan, maximize what you get out of your quality measures. So again, reviewing which measures you're reporting on and what those measures are looking like for 2023 to see if it makes sense to change anything or kind of stay the course and stick with the measures that you have been seeing the past couple years. Meet internally to discuss the importance of MIPS, best if the whole practice office is on board and kind of your united strategy for MIPS. And then in terms of technology, get your right tools in place, whether that be your EHR, your registry, outside consultants or billing companies, whoever you need to, like I said, kind of get everyone on the same page and be ready for your reporting in 2023. Okay, so we just have a couple screenshots of our MIPSPRO product. So we offer live dashboards and drill down capabilities. We help you identify gaps in care, improve your performance throughout the year, optimize scores, and we help you detect outliers throughout the year as well. So we're looking at our decile page here, where we're giving insights into how many points CMS is going to likely be assessing based on prior year's data for these specific measures here. All right, our easy to navigate dashboard designed for users like yourselves to understand, track and drive performance improvement, hoping we can help you out. We lead to better scores, higher reimbursements, improved patient outcomes through this is our gaps in care page. Our users are familiar with this, where we can help you attack, again, your gaps in care to improve your performance throughout the entire reporting year. And then again, just to note, our US-based, 100% US-based support team is available to you as a resource. Integration team, we help you reduce the burden of the quality reporting. We know it can be difficult, but we allow you to focus on, again, providing the highest quality healthcare to your patients rather than worrying about the administrative and technical burden of dealing with technology that can be difficult. So support team is there for you throughout the year, can help you navigate the system and the MIPS program all at the same time. Then we do have another MIPS webinar coming up in November here, so you all get our emails. Stay tuned for what that will be on for next month's webinar. And lastly, for more information, we would be more than happy to discuss your plans for 2023, answer any questions or any outline concerns for next year. Here's where you can contact us, and we'd be more than happy to set up a meeting, discuss, again, any questions or concerns for 22 or 23.
Great, thank you very much, Mara. Did fantastic there. To go over a couple of things before I get to some questions that we have, I did want to confirm with everybody that the CEHRT guides are not going to be required in 2022. That was a mistake by me on the slide that I took from the proposed rule this year. So you can ignore the idea that you need to do the CEHRT guides for 2022 promoting interoperability. And I will send that out in a correction in the slides when I send them over after the presentation. There were a couple of questions that were asked, and I think I can get answers to a couple of them. Otherwise, if I don't get to your answers, it may be because a little bit more research or information is needed to get you the correct answer. One of the first questions is, how do you become exempt from cost? So you can go on and take a cost exemption through the QPP site. However, If you are not one of the specialties that we added in the slides that you saw in the slides, you will most likely be exempt from cost if you're not part of a multi-specialty group. Multi-specialty groups have to be careful because the cost score is given on a group basis. So if you do not have the number of eligible instances associated you to have an attributed patient for any of the measures, you will be exempt from the cost score. Let's see, where can we find a list of measures and their classes? I don't think they list the classes in the final rule that came out, the 2022 final rule that came out. However, if you are a MIPSPRO customer inside the program, you can see what measures are capped out at 7 points, what measures are in the system that do or do not have benchmarks. All right. The next question here is, do I have any opinion on the cost category getting reweighted again for 2022? I don't. I have not seen anything that says that they will reweight it. If I were to put it, I think it's probably less than a 50% chance, but don't hold me to that. Just listening to what they have to say and how we can go about it, I don't think it's going to be reweighted in 2022. Forgetting what year it is there too. What is the file type needed if we upload from multiple systems? Highly recommend, if you're uploading data from multiple systems, to use a registry to report. You could bring all of your data there. You can match your patients to make sure you have it that way, especially if you have multiple EHRs for the same providers. You're going to want to maximize your score that way. Any other way to do that, you need to create a QRDA3, and that is not easy to do as a small practice or a practice. Give me one more minute to see if we have any other questions. I don't see any. All right. That is all of the questions I have answers for right now. I will be reaching out to you with our next webinar in November. Please feel free to fill out the information at the end of this when I hit end, so that you can get a add to our survey so we could better utilize your time here for these webinars. Thank you very much and have a wonderful afternoon. And thank you very much, Mara, for joining with me on this call today.
Thanks, Mike. Thanks for having me.
Bye-bye.